Well, I'm Robin Youngs. I'm an ENT surgeon currently based in East Anglia, and for the past 30 years I've been involved in initiatives to combat global deafness, chiefly working for two NGOs that work in Myanmar and Nepal. Also, I've been involved in global deafness for ENT UK. I set up the ENT UK Global Health Committee a couple of years ago, and they won an annual conference. I've also recently been appointed as Honorary Associate Professor at the London School of Hygiene and Tropical Medicine, and I'll be working with colleagues in the International Centre for Evidence in Disability on advocacy and research into deafness as a global issue. Well, in 1991, as a newly appointed consultant, I was looking for things to do, and I read an article in the Journal of Laryngology and Otology. It was written by Neil Weir, who set up the Britain-Nepal Otology Service. It was a very interesting and informative article, and it asked for volunteers. Asked the volunteers to go and join the NGO in Nepal. It said that you had to be used to discomfort, power cuts, cockroaches in your bed and that type of thing, but I jumped at the chance. We went to Birgunj on the Nepal-India border, and it was a real eye-opener, seeing the huge number of people who suffer with ear disease in that region and how it affects their lives. So it's only natural for me to continue that interest. I'm an ear surgeon by training, and other opportunities came about, particularly being involved in deafness initiatives and training in Myanmar, including a charity that looked after schools for the deaf in Yangon and Mandalay. And then more recently, I got the chance to get involved with ENT UK and set up their Global Health Committee. It's really improved recently because Shelley Chadha, who works at the WHO in charge of deafness, has really been working extremely hard. In 2017, the World Health Assembly passed a resolution on deafness that instructed governments to improve services and integrate deafness into their health systems. And out of that has come the World Report on Hearing that's being produced at the moment. It'll be the first World Report on Hearing, and it'll be published in May of this year. Also, has been set up the World Hearing Forum, which is a forum for people to get together on an annual basis and discuss in detail deafness initiatives. In parallel with this, there's been a focus on disability as a whole. So in 2018, we had the World Disability Summit in London. That's resulted in a number of programs. One has been a focus on assistive technology. So assistive technology are things like hearing aids, glasses, wheelchairs, and a program called AT Scale has been set up, and out of that AT 2030, to change the market in terms of developing assistive technology. Well, the most important thing is getting awareness. So awareness in the population as a whole, and awareness among deaf people that deafness is an important disability and also that it's treatable. Prevention is incredibly important. About 60% of childhood deafness is preventable. So measures such as good perinatal care, avoiding ototoxic drugs, and having a good universal immunisation programme are all measures that are going to prevent deafness in children. Noise is very harmful, and it's very important to have noise reduction programs and also noise protection for workers in a noisy environment. And that also includes people using headphones. So there's been a big focus on the dangers of using headphones to listen to loud music and that type of thing. Hearing aids are a problem because they're very expensive, and they're basically technology that's aimed at an affluent Western community. So it's very important to develop cheap and accessible hearing aids. Also, ear care as delivered in most of the world is provided by highly trained people, ENT surgeons and audiologists. And one of the things that can be done in terms of human resources is to reduce that cost by training primary care health workers. So, for example, the Britain-Nepal Otology Service has developed an extremely good primary ear care program. It's involved training people with just basic technical skills in ear disease. So they can't operate on people, but they can diagnose and treat the vast majority of ear conditions. There's huge potential in terms of research. At a basic level, we need to know how common deafness is. So basic epidemiological research is important. At the London School of Hygiene and Tropical Medicine, my colleague Tess Bright has developed something called the Rapid Assessment of Hearing Loss. And that's a survey program that can really estimate fairly accurately the prevalence of deafness in the community. So that type of information can be used to inform public health systems and health administrators to plan services for deafness. Also, the link between deafness and dementia is important, and there's a lot of research being done at population level and also basic science research to see if that link is genuine and to see if there are possibilities in terms of prevention of dementia. Also, having low-cost assistive technology is extremely important. Hearing aids are very expensive, and the vast majority of people who need a hearing aid can't actually afford one. Development of low-cost devices is a really vital part of research that needs to be undertaken. Well, firstly, to have a world where there's no stigmatization of deafness, where education and employment for deaf people is on a level playing field. To have a situation in which the large majority of cases of deafness that can be prevented are actually prevented. And also the development of cheap assistive technology.